Well,
I'm sick. I need an antibiotic.
oh, you're kidding me.
No, I have a sore throat. I need an antibiotic.
Do you have your copay?
No.
Oh, then get in line. And speaking of getting in line, you're going to get in line for our show that's coming up right now on It's Your Health. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Welcome back to the first segment of It's Your Health. I'm with my bride, bringing you the best, the latest, and greatest in medical information. And make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Right, dear?
So you're not going to give me an antibiotic for my sore throat?
Sweetheart, it's probably viral, and it could be made worse by allergies this time. And it brings us into, are we giving too many antibiotics?
All right, it's the first headline.
All right, well, do you want to tell us about it?
Yes, I do.
Okay. Sore throat's gone now, huh?
Too many antibiotics prescribed for sore throats. Despite efforts to curb the unnecessary use of antibiotics, many doctors still prescribe them for illnesses that don't respond to the medications. Antibiotics only work against bacterial infections.
That's true. So probably around 80% of sore throats or colds are actually flu-like illnesses, which are not going to respond to an antibiotic. You do want to make sure you don't have strep throat. So you'd be concerned if you saw white patches in your throat, high fever, things along those lines. So check with your doc. What's wrong now?
We get through one headline.
What ailment is this?
One headline, and it's already hot flashes in menopause.
Well, our wanting public wants to know these things.
Oh, sure they do. All right, FDA okays drug to treat hot flashes in menopausal women. Pfizer says it has gained U.S. approval for a drug designed to treat menopause-related hot flashes and potentially prevent osteoporosis in postmenopausal women who have a uterus. What does that mean?
Well, in the olden days, when you're postmenopausal, we gave you some estrogens and maybe some progesterone. And it turns out that's not a good idea because it puts you at risk for strokes and heart attacks and cancers and the like. So postmenopausal patients are not given, to a large degree, oral estrogen type compounds for those reasons. However, you then suffer. No, better yet, we suffer because we have to hear about all these hot flashes. And there's really no good drug for those, unfortunately. But help is on the way, so keep listening to It's Your Health.
Why do you think it's called menopause?
Is that right?
Yeah, that's right. Oh, okay. Daily walk may cut your breast cancer risk, although it sounds like it's talking about women only, but I'm sure it includes men in that. Older women who walk every day may reduce their risk of developing breast cancer, and those who exercise vigorously may get even more protection.
It is a resounding thing in our literature. Diet and exercise is probably one of the key things towards health and lowering your risk of a whole host of diseases besides this one, no doubt.
Two of my favorite things, exercise and diet. Just love them.
Is that right?
Uh-huh. This isn't really a headline, but it's sort of a headline. It's talking about what stress in middle age can do to women.
Oh, yes. Okay.
Because it's usually caused by men.
It's a good thing you have no stress. And you know, one of the keys is we're not together a great deal between both of our works, if you will. So that's why you have no stress.
This is not a show in which we lie.
Okay.
We tell our consumers the truth.
All right.
We don't sugarcoat the information. So be quiet a minute.
All right, let's...
Chronic stress, the effects on certain hormones may reduce the efficiency of people's brain circuitry. Chronic stress may contribute to the development of Alzheimer's disease in some people.
Yeah, no doubt. If you overload your car and run it too fast and make it carry too much weight, it's going to wear out quicker. You know, the shocks, the springs, and the tires and whatever. And our bodies are no different. And under chronic stress, you are going to, unfortunately, be prone to more illnesses. So stress is really a big event, and unfortunately, it's ubiquitous. It's kind of all around us.
And I have this sore throat, too.
Is that right?
Mm-hmm.
It's probably a virus.
I understand that. That's why you won't give me any antibiotics.
No, that's true. I'm looking out for you.
I know. This is the time of year where we're into the start of school. And I remember my exciting days at the start of school. Everybody was looking forward to it, and the teachers, the students, the parents. But there's always a couple kids out there who feel a little bit of stress about going back to school. Do you have some suggestions to help? Do I have to help you with this one?
I was going to lean on you. I think it's an issue, and I think to some degree it's why many of us feel melancholy in the times like right now in the fall, because it's always been associated with a separation anxiety. You know, going off to school, college, whatever. But go ahead, illuminate it for us.
Well, a couple things you can do is take your child to school about a week before school starts, get permission and walk them through the school and talk about how wonderful it is. Get a picture of who your child's teacher is going to be, put it on the refrigerator, get them used to seeing that face every day. And a question not to ask your child at the end of the day is, how was school? What did you do? Those are two questions. But more, how did your spelling test go? Did you get to draw in class today? What did you have for lunch? Be specific. If they hand you a drawing, say, oh, I really like the way you did the blue in the sky, rather than, that's a nice picture. Then they feel like you're paying attention and you care about what they're saying. So forget your schedule. Right now, take care of the kids. Make sure they're getting enough sleep, especially with the summer being over. Sometimes they're not back on a regular schedule yet. Get them back into enough sleep, because that will make them difficult and anxious and ornery, and you don't want that.
How come you never asked me how my day was? Or did I do any coloring?
Did you?
You never ask. She never asked.
I never ask. I'll remember to ask, though. I think it's time for a break.
Okay.
He's losing it
She's
fast.
going to ask me how my day was.
Yeah, I wonder how his day was. Did you color?
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information.
Welcome back to It's Your Health Menopause Edition.
Is that right?
Yes, because our first headline is, in this section, is of course about menopause. Hormone therapy won't prevent disease after menopause, according to a recent analysis. No good evidence supports using hormone replacement therapy after menopause to prevent heart disease or other chronic ills, but short-term use for hot flashes, that can be an option.
Yeah, again, we're getting away from hormone replacement therapy, and there's a risk-benefit ratio whenever we prescribe something, and here the risks are a little bit too high to get the desired benefit.
You know how I said in the last section that we have to be honest and truthful with our consumers?
Yes.
This next headline is just a lie.
Is that right?
Absolutely. Shopping doesn't help in face of trauma.
Oh my, well.
Shopping always helps in face of trauma.
Is that right?
Yeah, it says some people go shopping in an attempt to cope with the stress of traumatic events, but it makes things worse because traumatic events cause more stress for materialistic people, and they are more likely to spend compulsively.
Oh, well, that would be bad.
But shopping, that's very good.
Well,
When I have your credit card, especially.
it's a good thing you have no trauma in your life as well as
Did you
stress.
color today?
Is that right?
Okay, next headline. Big breakfast may be best for diabetes patients. A hearty big breakfast that includes protein and fat may actually help people with type 2 diabetes better control their urges and hunger and their blood sugar level.
And unfortunately, if you're like most, you skip breakfast, have somewhat of a lunch, heavy meal, and then graze throughout the night. And it's exactly the opposite of what we should be doing. We should kind of front load our calories and start out the day with a hearty breakfast. And you might find that it's going to carry you through the day a little bit easier, and you're going to cut down on that heavy loading as the day goes on.
Well, and isn't that true for everybody? Shouldn't everybody start off with a hearty breakfast?
No doubt, and particularly for our diabetics.
Okay. This is a good one. I like this one.
They're all good ones.
Married people, like you and me, you know?
Okay.
I know you don't like me to remind you, but anyway, married people may be likelier to survive cancer. They're less likely to die of their disease than those who aren't wed. There's a strong tie between tying the knot and beating cancer.
I think that goes for almost any illness. I think if you have a soulmate, a cheerleader, someone who you can lean on, I kind of view relationships like cards on one another. Without the one, the other one will fall. So we need to lean on each other.
Without the one, the other one will fall.
That's right.
Don't forget that.
The Joker's wild here.
Want to talk about lipstick?
Yes. I mean, what's in lipstick?
All bad stuff.
Really?
Yes.
Is that why I don't kiss you?
I don't know if that's why.
Okay.
Maybe we've been married too long. I don't know. A study has shown that every single lipstick and lip gloss that they tested contained manganese, titanium, and aluminum, and even lead. And those are things that are dangerous to all of us, and yet they're putting it in our lipstick.
Yeah, well, I'm not so sure we should be doing that.
Well, the other part of it is, how much of our lipstick do we eat?
I don't know.
No, I mean, we don't sit around, eating a tube of lipstick.
But, it's close enough to the mouth that you might end up, when you're drinking your soda or something, getting in. I think it's a big concern. And perhaps we need to get away from that particular cosmetization.
Lipstick.
Yeah,
no more lipstick.
Right.
Ever.
I won't wear any more lipstick.
Okay.
You're right.
No matter what color it is, you won't wear it. Take 5.
What does that mean?
That means take 5.
You going to tell us more about that?
I'm going to tell you that there are 5 nutrients you need to have in your diet right now.
Tell us.
Okay. The first one is the omega-3.
Oh, without question.
That's all you're going to say? You're not going to explain that?
Well, omega-3s are the natural anti-inflammatory, anti-aging. It's why I have no wrinkles. I take fish oils every day.
Because he's married to me, not because
Is that
he doesn't take fish oils.
I didn't talk about my pain in the neck, but go ahead.
Oh, proteins.
Proteins. One of the things that we are battling as we age is loss of lean muscle mass and protein. It happens to all of us, even if you exercise. Protein is a key to trying to reverse that.
Antioxidants, what are those?
Antioxidants, our bodies are like power plants, and we're continually putting off heat and energy, and as a result, we can actually form these things called free radicals, which are rusting our body, if you will. And antioxidants help to prevent that rusting that's going on inside us.
Fiber.
Fiber, a no-brainer. Fiber helps to lower cancer rates. It will actually lower blood pressures and sugars, and provides nice, healthy, bulky stools.
That was a very nice way to say it. And the last one is calcium.
Yeah, calcium, along with some vitamin D, by the way, but bone health is crucial as we age, and particularly as we're postmenopausal.
Are you postmenopausal?
Yes, I am. And you wouldn't even have known that, would you?
No, I wouldn't.
Let's see how I act.
Some things never change.
Speaking of never changing, we're never going to change the way we deliver healthcare information on It's Your Health. We're going to take a brief commercial message, and we'll be right back. Remember, you're watching It's Your Health. We're your leader in healthcare information. Welcome back to the third and final segment of It's Your Health, the fastest 30 minutes in television land. Correct?
Absolutely. Whatever you say, it's correct.
Jeez. What happened? Is this throat infection going into your bloodstream now?
Going up into my brain. I think we should just give people the information they're looking for.
All right, let's go right ahead.
So let me start. And it kind of fits with what we talked about at the end of the last segment about calcium. And this headline says, vitamin D alone doesn't boost bone health. Okay? Vitamin D supplements over the recommended dietary allowance do not protect bone health, whereas calcium supplements do have an effect.
Yeah, it's kind of an interesting twist. You do need vitamin D, probably 800 to 1,000 units every day. And it will do other things which are beneficial. It may prevent falls, for example. But nevertheless, when we get back to bone health, you need the calcium along with the D. So they're kind of...
And can you get that through your diet?
Yeah, generally. Yogurt, calcium is in dairy products, things along those lines. I generally don't like calcium supplements if you're eating a well-balanced diet.
I've always hated yogurt, and lately I just love it. I don't know what happens when you get older. Your taste buds change, I guess. I don't know.
I don't know either.
Do you ever see people wearing those copper bracelets?
Yeah, like for arthritis or it's magnets or something like that.
Yeah. Those have been things that health professionals have believed in for thousands of years, that magnetism and copper will magically cure you or alleviate symptoms. Guess what?
It's going to lighten your wallet?
Yep, and that's about it. It doesn't do anything else for you. Copper bracelets and magnetic wrist straps have no effect on pain and swelling in rheumatoid arthritis. They have no effect in preventing the disease from getting worse.
Right. That may be true, and it illustrates what is a tremendous thing in our line of work, and that's the placebo effect. And that is to say, by doing something that does nothing, the fact that you're doing something may actually make you feel better.
Doing something that does nothing.
It's kind of like me and you.
Somehow that fits into marriage somewhere.
Right.
Yes, that's exactly what I was thinking.
We've been doing this for years.
Chest pain, less common in female heart patients. And I feel about this one very strongly because women don't usually feel the chest pain. They get other symptoms. And unfortunately, in some cases, medicine has not caught up with that fact yet.
No, women and particularly the elderly, what we're taught is that the organ of least reserve is what's going to manifest itself if you're, for example, having a heart attack. So shortness of breath, if you have underlying lung disease, is going to be a sign that you may be having a heart attack. If you're elderly and have dementia and you're becoming more confused, guess what? Look at the heart.
No kidding.
So
that's really good.
You want to take special attention if there's a change in the way the patient is acting or breathing. Vomiting, for example, could be a sign of a heart attack. Not everybody, particularly women, particularly not the elderly, are going to get the chest pain going down the arm.
And 35% of people who are diagnosed with chest pain and what follows never have chest pain. 35% don't suffer from chest pain. And those who do have chest pain are treated more quickly and more efficiently.
Yeah, it is kind of a buzzword, as opposed to if you go to the emergency room and say, well, I'm perhaps weak, it may not have the same connotation as chest pain.
Chest pain. Okay. This study doesn't prove why, so I don't know why we're talking about it, but anyway, seniors suffer less headache and nausea than younger people after heavy drinking. In other words, if you're a senior citizen, you're less likely to suffer from a hangover.
I'm not sure why that is, but you would think the opposite. You'd have more trouble metabolizing the alcohol, and again, you might, like any drug, have a side effect from it. Of course, alcohol is a drug. There could be just the fact that they're getting used to it and they're getting better at it, if you will.
That doesn't mean you should be drinking right away and every minute of your life now up until you're a senior citizen so that you don't get
No, but
hangovers.
in all honesty, a lot of my patients who are in their 80s and 90s, there is a common theme, particularly in the guys, and that is they usually have a drink every day. They don't get lit, but they have a drink every day, and they have a woman in their life. And they may not get lit every day, but they have a woman in their
See?
life. So
Woman in their life.
Yeah.
See how important that is?
that is
See how
important.
vital that is?
It is vital. I agree.
That's good. I'm glad you know that. We're going to go on to a very serious topic now, and I need you to take the reins here and tell us more about hepatitis.
Right. It's becoming an epidemic, and we're now told that if we see someone who's a baby boomer as part of their regular physical exam, we should be testing them for hepatitis. And they'll say, well, how could that happen? And it does happen. We can pick up hepatitis B and C. These are communicable diseases, and perhaps in your youth, when you were a baby boomer, you did things that perhaps you're not doing now where you could have contracted the disease. But it's a slow-growing virus. The hepatitis C, of course, has some treatment to it. And keep in mind that hepatitis B is preventable. There's a vaccine against it. So that's sort of a no-brainer. Think about that as you're seeing your doctor. You may want to get vaccinated against Hep B, particularly if you're a healthcare worker or exposed to things like that. But hepatitis C, we don't want to let that go on because it's a treatable condition.
It also says here that almost always it's a deadly disease if not treated.
Well, that's true because it keeps on gnawing at the liver. You end up getting scar tissue and the like. So yeah, we'd like to have our baby boomers screened for hepatitis.
Okay, is that going to be part of the Affordable Care Act?
That I don't know about.
Okay, well, we're not going to talk about that yet. We're going to talk about hearing, and especially earaches in babies. How do you know that a baby is suffering an earache, and what do you do about it?
That's hard. Maybe you can enlighten us.
Probably not, but there are various symptoms that a baby may have. They may pull at their ear, there may be drainage from the ear, but there may be nothing more than some diarrhea or some extra clinginess on their behalf, and those could all be signs of
an ear problem, yeah. And they particularly are prone to it because the eustachian tube, which drains the inner middle ear, is so small that it doesn't take much for it to get clogged up.
And isn't it more horizontal than vertical?
Right, and so all these things contribute to congestion, effusions, fluid on the ear, which then can lead on to an infection. But it can be an irritable thing for a youngster. So I think if your kid's acting irritable, I would.
Do doctors recommend antibiotics?
Well, only if we do see an active infection, because a lot of these things, as mentioned earlier, are either viral or the child could be teething, for example, and so we don't want to be throwing in antibiotics unless we truly have an indication for it.
Another example where we don't use antibiotics.
Correct.
So we don't need to go to the doctor.
I didn't say that.
But if we do, we need to understand the Affordable Care Act, which is also known as Obamacare. Would you like to explain a little bit about that?
I can't say I know a lot about it, to be honest with you. I know there are certain things that we're going to put up on this full screen that's going to show you things that we kind of know about it. But I think we're all kind of wading into the water here and finding out. It's excellent that everybody's going to be having insurance. If you have insurance with your employer, chances are it's going to stay that way. Mm-hmm. And if you don't have insurance, you probably are going to be asked to get it in some way, shape, or form. One of the worst things in my line of work is to see a patient who has an illness and they don't have insurance. It sort of handcuffs both of us in order to treat it. And we don't like the idea that people with pre-existing diseases couldn't get insurance. So all these things I think are going to play themselves out. And if you kind of just give it a little bit of time and a little bit of effort, I think it's going to be a great thing.
Do you think it'll mean that more people go to the doctor?
If you have insurance, probably.
So we're going to need more of you.
Well, I don't know
How's
about that, but
we're going to have to clone him after he's done coloring.
It's all right. Well, speaking of done, we are done with the final segment of It's Your Health. Another fast and moving and furious 30 minutes, just like us.
Thank you for being with us, and we hope that you'll join us next time also on It's Your Health.
Thank you.